Let's proceed to interviewing. We have a case history, endometriosis, blood stasis deriving from cold in the uterus. A 28-year-old woman had been suffering from painful periods since menarche. The periods came regularly and lasted 9 to 10 days. The menstrual blood was dark with occasional clots. The pain was stabbing at times, but at other times, it was a dull, deep ache rather than a pain, and with a pronounced feeling of heaviness. She said, "My whole lower body feels thick, heavy, and stodgy," which was clearly her way of expressing what in Chinese medicine is called a feeling of heaviness. The pain was situated in the central lower abdominal area and was alleviated by a hot bath. Recently, she had been experiencing pain on intercourse, which was sharp and also located in the central lower abdominal area. Apart from painful periods, she had been experiencing a dull mid-cycle ache on the right lower abdominal area for the past 2 years, which was accompanied by a dark brown discharge. She also suffered from premenstrual tension, manifesting with irritability and distension of the breasts and abdomen. On the basis of an internal examination and an ultrasound scan, she had been diagnosed as suffering from endometriosis. Other symptoms elicited from interrogation included cold limbs, occasionally a feeling of heat in the face, palpitations, anxiety, and tightness of the chest. The tongue was red on the tip, and the pulse was slightly slippery in general and slightly tight on the left rear position. The stubbing character of the pain and the dark color of the menstrual blood with clots clearly indicates blood stasis, which most probably derives from cold in the uterus. We can deduce the presence of cold in the uterus from the alleviation of the pain by a hot bath and also by the history. In fact, if the periods are painful from the time of menarche, the most common etiological factor is invasion of the uterus by external cold due to playing games wearing shorts in cold and damp weather. In this case, therefore, cold in the uterus obstructs the circulation of blood and causes blood stasis. In addition to blood stasis, there is also a clear pattern of dampness in the lower burner, manifested by the occasional dull ache during the period, the pronounced feeling of heaviness, and the mid-cycle pain. There is also some liver chi stagnation causing the premenstrual symptoms. Occasional feeling of heat in the face, cold limbs, palpitations, anxiety, and tightness of the chest can be explained as manifestations of rebellious qi in the penetrating vessel. In fact, given the symptoms and the menstrual symptoms, we can say that all her symptoms reflect a disharmony of the penetrating vessel. The main treatment principle is therefore simply to regulate the penetrating vessel by warming the uterus, invigorating blood, and resolving dampness from the lower burner. Thank you for your attention.